So our question today is, the nurse is reviewing new prescriptions for a client with end-stage renal disease. The nurse should clarify the prescription for, and we have an open-ended stem and 4 different options. So we are looking for which one of these medications would require clarification with the healthcare provider before you would give it. So we're looking for which one of these ones are not indicated for a client with end-stage renal disease. So end-stage renal disease is a chronic condition where the kidneys are no longer able to filter the blood as well as they used to. So when we go through the medications, the first option is metformin. So metformin is an oral anti-diabetic medication used to treat type 2 diabetes. So this medication is reduces glucose production in the liver and is actually processed primarily through the kidneys. So our client has end-stage renal disease. So any medications that require metabolization through the kidneys are at a higher risk for complications. So clients who have end-stage renal disease and are taking metformin actually have a higher risk of developing lactic acidosis, which can be life-threatening. So metformin is something that we would want to clarify with the healthcare provider. Going through the rest of our options, erythropoietin is a hormone really that's produced by the kidneys to stimulate the production of red blood cells. So in clients with end-stage renal disease, they often develop anemia and they require erythropoietin injections in order to make more blood cells. So this is something that would be indicated for this client. Acetaminophen is metabolized through the liver. So we often think of questioning acetaminophen if the client has impaired liver function, not really impaired kidney function. So acetaminophen would be appropriate for this client. And phosphate binders are some medication that you take with food in order to decrease the amount of phosphate that is absorbed in the GI tract. So clients with end-stage renal disease actually have too high of phosphate levels in their blood because of the impaired ability to filter through blood. So phosphate binders are often prescribed for clients with end-stage renal disease in order to keep the levels of phosphate in the blood normal. So out of this options, we would clarify the prescription for metformin.